The reason for my speech today is to inform you all about strokes and address many questions you may have about them. Almost 5 years ago, my mama, who is very close to me, had a stroke, and this event changed her life forever. I'm here to explain the things that me and my family wish we knew about this very common but tragic diagnosis. There are 3 types of strokes: the ischemic, the hemorrhagic, and the transic ischemic attack, also known as a TIA. The ischemic stroke is by far the most common, being 87% of all strokes. This is blood clots or other particles blocking arteries, causing little blood flow or oxygen to your brain. The hemorrhagic stroke is a rupture of an artery, causing you to bleed and puts pressure on your brain cells. A transic ischemic attack, or a TIA, a warning stroke, a mini stroke, is a temporary block of blood flow which will clear out but is a very serious symptom of a real stroke in your near future. Now that you know the types, here are some causes. One being age. It is very prominent for people over the age of 65. However, it is important to know that strokes can happen to anyone, anytime, anywhere. Another being high blood pressure, high cholesterol, heart disease, obesity, diabetes. Even your gender or your location could play a role in your risk of a stroke. Strokes that end in death are more prominent in rural areas, and more men deaths over women overall. Behaviors increasing your risk of a stroke could be anywhere from your diet to your consumption of alcohol. It is important to keep your diet with less high saturated fats, cholesterol, your alcohol consumption low, your tobacco usage low, because it damages your heart and blood vessels. You definitely need to keep your physical activity level high to maintain your health. Symptoms of a stroke could be numbness or weakness in your limbs or face, especially on one side of your body, confusion, trouble seeing, trouble balancing, walking, and especially a severe headache with no known cause. If you see these symptoms in yourself or anybody else, it is important to act fast. FAST being an acronym. F meaning face. Ask the person to smile. Does one side droop lower than the other? Ask the person to raise their arms. Does one side fall down? Ask the person to speak a simple sentence. Is it slurred or strange? T is for time, because you must act fast. At the hospital, you will get brain scans, and you will potentially get to work with a neurologist to get treatment, because you need help quick. In the hospital, you will be treated for your stroke. For an ischemic stroke, you will get a thrombolytic medicine such as tissue plasmagenic activator, also known as a TPA. Patients who are treated with TPA are more likely to fully recover if given within the first 3 hours of your first symptom of your stroke, which is why it is so important to get help so quickly. You could also get blood thinners to break the clots or surgery to fix any damage. For a hemorrhagic stroke, you could get endovascular procedures to prevent any more blood loss. After a stroke, you will experience things like paralysis, trouble thinking, speaking, or understanding others, trouble controlling emotions, pain in your hands and feet, trouble chewing and swallowing, or maybe even depression. After the stroke, you will get speech, physical, or occupational therapy, improving your daily activities like eating, drinking, bathing, reading, etc. For speech, you will be able to produce and understand speech better, and physical, to relearn your movement and coordination skills. In conclusion, strokes are a very serious, life-threatening matter. It is very important to make sure you know the signs and symptoms so you can get yourself the help that you need, because the rate of survival, if treated correctly, is 66%. You need to make your mental and physical health a top priority in your life to avoid the chances of a stroke that will affect you and your family forever.